you know, a tissue that's not going to wreck your nose.
Sneaking Charlie, our dog, in for her birthday.
Hot air balloon ride.
The ukuleles. There's been a few patients who we've actually bought ukuleles for.
A little chapstick.
New set of pink sheets there from like Ralph Lauren with a nice fleece blanket.
Her grandson showed up and they had an ice cream sundae party.
Little presents for us, Godiva chocolates.
200 families that people were able to help over the holidays.
New Kids on the Block, James Taylor.
It can help them maintain their house. It can help them keep their house.
They gave exceptional care, but it goes so far beyond that.
They've created huge bright spots for anybody going through this.
Oncology nursing is different than a lot of other types of nursing because of the amount of time that we spend with patients and their families at the bedside, getting to know them. You know what people are going through. You know that they're tight on groceries this month. You know what parking adds up to after a month of visiting someone in the hospital.
What can we do to sort of ease that burden a little bit? What can we do for those 4 kids at home who aren't seeing their father?
When words or medicine fails, we can do something to acknowledge what people have been through.
It's a dark time, and I think the purpose of Caring for a Cure is to try to bring some bright moments.
I was diagnosed about 4 years ago with leukemia and immediately came to Mass General and to London 10. So this has been my home. For the last 4 years.
The only reason we know what the patient needs are is because of the nurses at the bedside. That's every nurse and every social worker and doctors within the cancer center.
The nurses are so close to the patients that they know what's going to work. The hit rate's going to be pretty damn good. Whether it's a guitar, whether it's a night out.
Timmy was in for a couple of months, so I was staying with him every night, and they finally came and said, "Here, we've booked you. You're going to the Liberty Hotel. Enjoy a night out and away and in luxury." They could sense that I guess that I needed it, and
they did it.
Did it for me.
There's no medicine for the caregiver. It's a tangible, concrete thing that we're able to do to take care of someone that is going through something that's just as difficult as what the patient's going through.
We went down to the lounge that said reserved, and it had 2 hearts on the door. And we went in, and it was really kind of magical. It had happy 37th anniversary. It had hearts on the window. It had our favorite meal that they secretly got my daughter to get from Medford. Caring for a Cure just created that moment for us. And then, so I took all the pictures and made a book out of it because it was just such a wonderful time for us there that every time he had to be readmitted, I would always bring the book so the nurses could see like what an important event that was for us to celebrate our anniversary.
It's Linda's and Tom's 37th anniversary. It's not like it was a big number, but everyone is important because you never know.
My daughters would often say they'd never seen anyone so happy to be in a hospital when my husband was on London 10. Didn't always luck out and get London 10, but when he did, it was like he hit the lottery.
I can't tell you how many people came up to me and would compliment Dad and say, "I've never met someone with cancer who have such a positive outlook," and the nurses did so much to give him that. It's hard to put into words as to what this team can do for families that are going through a difficult time.
A lot of the patients and families whose lives who we've been able to touch, they want to give back.
They then want to feel that the joy that it is to know that they're giving to something that's directly going to affect a patient and a family.
Unfortunately, after Rita passed away, we wanted to do something to stay connected and certainly continue to support anybody that might be going through what she went through. And we had our first year where we did the Nantucket Triathlon for Team Rita, and we raised well over $30,000 that we were able to give back and provide to Caring for a Cure and just hand them the funds and say, "You guys go do it, you do best." We're gearing up for round 2 this year, where hopefully we're going to push over 50 people and maybe try to break something around $50,000 this year, which would be pretty special.
It is incredibly dependent on donations. The donations that we receive allow us to provide services and provide support for these patients.
Research is incredibly important. It's a huge piece of this hospital. But I think, in the meantime, part of the reason why I think this fund has grown so quickly is that we're able to do so much for people in the interim. It's supposed to be quick, it's supposed to be on the ground, and it's supposed to be in real time because that's what people need.
Any donations go directly to the patients.
If you want to put a smile on somebody's face, write your check.
Dad's living spirit, that's all the proof anyone needs to donate anything, because that's the result.
Jeff respected them, loved them, and appreciated them so much in everything that they did. I can say as a family, there's nothing more important to us than supporting Caring for a Cure.
Agreed. It will always be important to us.